Let's talk about free buses for a second. I've seen a lot of opposition to free buses from the same people that oppose free college. And the main argument that they made at the time for being against free college is they said, if you make college free, then you're going to be helping people that make more money than people who never went to college. So it's actually regressive. If you give free college to all, then the higher income people are going to get the benefit. So it'll disproportionately help rich people. And that's such a bad policy. Your policy should be focused on helping the poor the most. Now, this is bullshit for one reason and one reason only. The fact that you charge tuition means a lot of poor people never even try to go to school because it costs money. You end up filtering a bunch of people that might want to or have the talent to go to school, but don't because they don't have the money and they started from a lower class position. Part of the reasons why college is a class reproduction machine. But the thing about transportation and public transportation in particular is free buses would disproportionately help the poor. Who do you think rides the bus? Lower income and lower middle income people, or people that don't have the money to afford a car, or unemployed people. So by making buses free, you would be disproportionately giving money to the poorest people, and that would disproportionately give them economic mobility. Here's a study from the National Association for State Community Services program. Access to affordable transportation for low-income workers, elderly, rural residents, and children makes the trip to work, school, and medical appointments possible. It fosters self-sustainability, promotes independence, and permits spending on other household essentials. Transit can improve economic efficiency. For example, when a transit system allows an unemployed individual to find and keep a job, that can save the federal government and states significant costs by reducing payments for such payments as unemployment compensation, food stamps, temporary assistance for needy families, and or Medicaid. When an elderly resident is unable to drive, uses transit to obtain health services, this promotes preventive health care for rural seniors, thereby driving down overall healthcare costs. It reduces social and economic inequalities. In 2000, transportation costs accounted for 36 cents out of every dollar spent in the poorest fifth of American households. So in other words, when you allow poor people to have free buses, that will save them massive amounts of money. It'll increase their economic mobility. It'll help drive down things like healthcare costs because it opens up the ability of getting to the hospital and getting preventative care. It has all these knock-on effects that are overwhelmingly going to benefit the poorest people, because who are the people that are going to be stopped by, a $5 fare? The answer is the very poorest. So by making it universal, you are actually doing a positive distributional program. This is a way of doing economic distributionism while also increasing utilization of public transit, thereby driving down carbon emissions, thereby driving down congestion.